Okay, guys, that will be like a very warm and friendly episode, not like the first one, because we are friends and we know each other like for years. And so I hope you enjoy it.
Yeah, with a lot of jokes, dancing, and singing. 1, 2, 3, 4. Hop, na di na na na. Hop, na di na na na. Hop, na di na na na. Na 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 na. Okay. So, how exactly Este patients they are dancing even after the Endolift treatment?
Oh my God, yes, we will go back there. So we're here. Hello, guys, on the Este Show. And we are here, my God, in the 7-star clinic, the only one, the 7-star clinic in the world. I'm the patient. And no matter, I have like a very, very, let's say, interesting. So I have a very interesting procedure. I will tell you later. Yeah, we still, Dr. Kheda and me, looking good. You actually look stunning. We are very close friends with Dr. Kheda.
Yeah.
I'm happy to call her my best friend. And we've known each other over the years. All you can see, like my face, my lips, my chin, the texture of my skin, it's all because of Dr. Kheda. That's why I was here today to try a new procedure called Endolift. Like in past 8 months, I lost about 15 kilos and still working on that. And it was a big problem with my skin tightening as I'm 38 now and the skin.
No way. She's 38, yeah, but she looks like a 25 just only because of me. I'm sorry.
Yeah, definitely. That's definitely. So I first heard about like Endolift before I knew that you have it in your clinics. And by the time I saw it in your Instagram, subscribe guys, I knew that I have to do it. And now I'm sitting here after the surgery. Can I call it surgery? Because
Yeah, because it's
like this actually. So I have high tolerance to pain. So I might be not, it will be controversial. Maybe for some people it's quite painful. You will tell us later. I feel good. You can see I'm smiling and I'm alive.
and she survived.
And I survived. And actually, it was a wow because I can see like the effects right after we did it. Like Dr. Kheda couldn't even fold it. It's just slipping my skin. And wow, can you tell us more about how it coming from the dramatic side and the doctor side? Because I can only just be patient talking about this.
Yeah, for sure. So, first of all, it's the simple and difficult the treatment at the same time because if the doctor knows how to do the treatment, he has like a real original the machine, not all these the fake machines which is in the market. So then it's very safe and easy treatment. But of course, if there is some but, then it will be a little dangerous even. We can see some side effects like fibrotic tissue, the fibrotic process, or like scars and many, many other things. But basically, yes, it's simple, easy. We have the fiber with some special energy. Of course, the settings we will choose depends the what exactly we want to reach what results we needed. So if it's talking about the fat melting, we will go the deeper with some mode and settings, and we'll work with the fiber for the fat melting. Then we can change the settings and go a little superficial under the skin, subcutaneous to work with the skin for skin tightening. So we can close the two things. We can do the fat melting for like lipolysis and skin tightening. If we need just only skin tightening, of course, we can go that way. We can choose the settings for the skin tightening as your case, of course. So if we need just only fat melting, we can do this only fat melting. But be honest, like most of the time, if we need a fat melting, we need a skin tightening as well. Mm-hmm. So yeah. First, I always will give some injections with lidocaine and normal saline to numb this area. This is the most painful part because we use lidocaine is a little panting inside. And of course, it's cannula, so that's why. But the most important thing, cannula, it's not sharp. And when the patients, they can see the like long needle, they scare, like, oh my goodness, you can damage something inside. No, it's really, really, really difficult. I can say like it's not possible to damage any vessels, anything with the cannula. So you're completely safe. Don't worry about it. Yeah, so I will numb all this area where I will work, and then I will slowly start to work with Endolift. And this part, sometimes patients, they can feel some heat or some sensation, but most of the time it's painless. But please tell me how it was for you. Not part with the anesthesia, not part with the cannula, exactly part with the Endolift.
Yeah, first of all, I think I didn't mention the area. So we did the abdominal area. And let's say it was like a little bit hot in some time. But overall, yeah, it was like.
It was fine.
Yeah.
Yeah, because I cannot control for 100% where is exactly the saline with the lidocaine, where is not. But I try to, of course, to control. Like there is like definitely deep there. It can be some like 3, 4, 5 centimeters without. So then that part you can feel it. But basically, yes, it's completely fine. And of course, it's safe, especially, let me say again, when the doctor knows what he's doing. So yeah, for the abdomen, for the legs, for the sides, for the back, for example, it's completely safe. For the face and neck, we have some special areas which we will avoid, whereas the nerve is too close to the skin, for example, this part and the thyroid part as well. But yeah, basically safe.
So I heard that it could be like two types. It could be for fat burning and tightening, which we do, and it could be used on different parts. But what are the most common parts, and where it used like works better? Like,
I believe we don't have some special area where is the works better. No. Yeah, I have actually some parts which is more famous. The people, the patients, they're asking. It's like a lower face, like double chin area. Yeah, because here the fat melting, it's not so easy, unfortunately. But yeah, most of the time it's lower face and the chin, and sometimes the neck face. Yeah, but abdomen, of course, the people asking as well. Yeah.
Yeah, that's true. And talking about other procedures could be, I heard maybe you told me that Morpheus, it's a good thing to do like from the skin. So you suggest to combine like two types or not for all the patients?
Yeah. First of all, it's not for all the patients, but if we can see a lot of saggy skin, there is a lot of work, then of course I prefer to work under the skin with Endolift, let's say that, and on top with the Morphos. Then we can reach the amazing results, really, really, really good results, because we don't have any magic treatment. We cannot do just only one treatment and think like, okay, it will help me and it will give me the perfect result and I don't need anything. No, it's not worth like that. I'm not surgeon. Even if you will do the surgery like tummy tag or something like this, there will be the huge scars which you need to work with as well. So with CO2 lasers, fractional lasers, skin pan, wherever, but still. So I prefer to work with Endolift and on top the Morpheus treatment, and also after like a 1-2 months maybe with the polylactic acid like Sculptra, Istafil, and other injections. But yes, the combination of the treatment always will give us the much better and more result. And yeah, nothing permanent in our life. We continue to getting older and older. So don't expect like you will do the Endolift once or Endolift plus another treatment once, and that's it. Alas, your tummy or your face will be like 90 years old. No, unfortunately.
By the way, the one point, I think the main point why I love how you work, and so why I'm happy that you are here in Este Clinics is that you don't like you don't try to sell something that's not needed. Like
Absolutely.
do yourself, just try to be preventive and not to do like a lot. And this is the values of the clinics, and that's why I asked you about this combination, because I know that you're not going to say that, oh, you have to do like all this stuff. And yeah, that's really important to me, like as a client also. And going back to my procedure, I do feel a little swollen, and it hurts a bit, the points where you have all these needles. Talking about the recovery, any like crucial points I need to know for the recovery?
Yes, of course. We'll always, after the treatments, we'll give you some post care. Even before, we will give you some post care to just take some idea, how it could be, like what to expect. So, but basically, the swelling, the redness, even a little pain, like heat sensation, it's completely fine. Because can you imagine? We put a lot of saline under your skin. We give a lot of energy with the Endolift to your skin, and fat burning works as well. So of course there is a inflammation, there is a swollen edema, whatever. So yeah, it will take some time. Basically, I always recommend it to use some compression bandages or something like this. It will always help to skin and to the body to recover faster. But it's, of course, up to the patient. And also for the face and neck, especially, I recommend it to do the massage at home 2-3 times per day. It will help the swelling to go faster. For the body, it's not make sense that much, but it will be good if you will do like a massage by yourself at home. I will explain it to you, everything. So yeah, but all these feelings, they are completely fine.
As a big Pilates fan, I'm just curious when I go back to sports.
Basically, I recommend it like 48 hours or something like this. If we talk about like light cardio, just a walk, you can even after 24 hours to go to help to lymphatic system to work easily and quick.
And if talking like, I guess here like everything's clear to me. Like I like the result even now, but you told me that I'll see the final result in 3 months, right?
Yes, it's up to. The first results, of course, you will see immediately after, but it will improve and improve and improve and improve. Don't think like it's, again, magic. We need to wait. Once we will stimulate our skin cells to produce more collagen, so they need from 28 days until 90 days. So even it's all about like individual things. I mean, your metabolic system, your lifestyle, your age, your hormonal panel, So if once it's young patient, they will reach the result faster. If it's like a middle age, let's say like this, then it will take us some more time, especially if the hormones they're less. For women, it's really important. So yeah, we expecting the results from 1 month until 3, 4, even sometimes 6 months. We can still see some improvements more and more.
Guys, you should know when you're in your middle age, you can't, you're not young anymore. You have to eat protein, eat greens, work out regularly. You need functional trainings, definitely. And if you're doing all this stuff and you try to work with your body to make it functional, not like to look younger than you are, but to functional, to force yourself to go out in plus 40 and not die, to go and have a nice hiking and so on. But overall, I'm healthy. But what do you recommend to me just to boost my energy maybe or my health?
First of all, it's time to time, like 2 times per year, do check up. Because, we have a lot of deficiencies what we even don't know because our food, our stress, I don't know, many things. So this is important. 2 times per year, do just the regular checkup. Check your blood, do like vitamins panel, hormonal. It's really important. The second, of course, the preventive medicine. So once we will decide like what deficiencies do we have, we can do the IV treatments. We can give you some supplements. We can check your. We can give you some like nutrition diets. How you can follow some special food part or whatever. We have the amazing nutrition coach. It's Juliana. Juliana, hi. Like, in old radio, some, like, yeah, like, I want to say hi to my parents. Yeah. Hi, Juliana. So, yeah. And also the oxygen. I already talked about the oxygen in the previous hour part, the first episode, that in Dubai, we are not living in the jungles, unfortunately. Even if we talk about some Europe countries, wherever, it's still not like, jungles. So, especially here, we're living in the middle of the desert. So we need more oxygen. Oxygen is our life. No, oxygen will give us good sleep, good brain work, good for heart, for vascular system, for the muscles, especially if we're doing the sport, the muscles more active, they need more oxygen. Where we will get if we don't have it enough. So for the hair, for the nails, for hormones, for all the things what's going on in our body process, we need oxygen. This is our life. But here we have some oxygen deficiency. So that's why in Este we have oxygen chamber, and why it's important to take your oxygen in chamber. You say like, I can just take the balloon with the oxygen and breathe. No, for 100% oxygen, we need a high atmosphere pressure to be sure that it will dissolve in our blood. So that's why you're sitting in the chamber, you're breathing with the oxygen, and we're increasing the atmosphere pressure to be sure that your oxygen will be delivered exactly where it's supposed to be. It's the other thing. So the new thing is 10 passes ozone therapy and the EBO. We will talk about later in another hour episodes, just a few words to get the antiviral, antibacterial, antifungal to prevention the many disease, especially like a cancer as well. It's really good treatment when we will give like the ozone and like detoxification for your blood, for your body with 10 passes ozone therapy. But more we will speak, as I told you, in another episodes. And what else? Stem cells. We have the amazing episode about the stem cells. You can check the previous one. Is it amazing for regeneration, for the men's health, for women's health, for more energy, for skin, for joints, for recovery after the surgery, so many accidents. Even we can inject not just only IV do the stem cells, we can inject for some special parts where it was the injuries. I mean, like skin after the burns or wherever. So here in Este, we try to, take all the best treatments to be sure that we will give results to our patients, to be sure that we will 100% help them. That's our goal.
Actually, I have a provocative question for you.
Okay, do it. That's good.
Okay, so I found you many years ago, and you are my doctor. And as I'm not living in Dubai, I'm coming here also to visit you and have some procedures. Like, can you say 3 green flags how you should choose your doctor, to find your doctor? So many clinics in Dubai and so many doctors. And as you said, if it's an original Endolift, for example, or others, and you said that in doctor's hands, he know what to do. How should I, not me, other potential?
Yeah, thank you. It's amazing question. It's amazing question. So let me think. First of all, I believe the intuition has everyone, and you can feel it that the person, the doctor, he lied to you or not. Something inside can tell okay, it sounds strange, whatever. So I think you need to listen to your intuition, at least to try. As first, The second, when the doctor, he wanna right now, right here, to inject as much as he can to take the money, and that's it. So he will not tell you like, okay, today we will do like 1, 2, 3 for you. So after 2 weeks, we will do 3, 4, 5. And because your body needs some time for the recovery to give the reply, all these things. And he will just go, okay, 10 milliliters of filler and Botox and I don't know, like skin boosters, everything, like 1,000 milliliters hyaluronic acid I will inject to you right now. You will pay for me, I don't know, like 50K dirhams, and that's it. And after that, he will forget about you. Yeah, this is the really bad thing. So it's red flag. Definitely. So the green flag is the doctor don't want to sell to you everything, all the injections to do right now, right here. No. He will still explain to you why this treatment exactly for you will be good and all these things.
And cares about you after treatment.
Yes. And he will book for the follow-up to be sure that you're okay, like to hear your feedback. And the third, oh my goodness, what it can be the third? Not even the doctor clinic. If, believe me, the price it's very, very low, there is like a questions. For example, like an Endolift treatment, like here will be 5,000, here will be 500 dirhams. Come on.
Yeah.
Yeah. You need to like, okay. So check the price and it will give you some idea as well. Like, okay, if it's too low, maybe something is wrong there. So something in the middle. We're not saying like too high, but still, yeah. To be sure that doctor using original product, original injections, original machines. And the clinic and doctor has all the certificates for the treatments, for the machines, for the injections. Yeah.
And talking about like overall, you also can check the license of the doctor if it's
For sure.
here in Emirates. It's like good,
For sure.
good thing.
Yeah, it's really good.
And talking about you, like me as your friend, I know what you've been through to stay here and to be here, and all the path. And I admire it, and I'm so happy for you. But how do you feel about it? What do you like mostly to work as a doctor here in Dubai?
In Dubai or in Este? This is the important. I love to be the doctor in Dubai. I really love. I love the respect how everyone with the doctors. But when I came to Este, it completely changed my life. Because how is my boss with doctors, with all the team, even, doesn't matter, it's housekeeper or I don't know, or medical director. Oh, nani.
Even Beverly, I'm in love with Beverly. She was just like very supporting to me. It was like
we have the best nurses, really, really, really. Especially when my patients, I see they feeling the pain. She's always giving me her hand. She's doing like this, and my patients, they love the Beverly. She's my star, my heart. I don't know how I can be without the Beverly.
Yeah.
Don't get me wrong. I love all the nurses. I love the Risa. I love the Carl. I love the Daphne, Madi, everyone. Our HT team. But she's my star. I'm sorry, guys.
It was like actually a very outstanding experience when you first come into the clinics, and the staff is so friendly. In the first episode, you told that it's like your family. It actually is. So everyone, starting from the reception and everyone, the barista, they're so friendly. And as I told, I had the chance to meet some today and to have a small chat. And everything about the values and about the legacy, and he's really like here every day, and he's greeting everyone, and you can feel all the passion that he had. This all he's telling me, and about the 7 stars that it's all about the comfort and so predictive service. Like haven't met such a productive service anywhere. So I feel like I'm not working here. I'm just the patient.
But now, after these 2 days, she's really dreaming to be here in Este.
I'm going to leave this show right now.
If you needed like a psychological support, maybe she will stay with us for the patients who are a little afraid of the treatment.
Yeah. I'll take Beverly's.
She was like, everything will be fine.
So you just like we have the recommendation. If you do like luxury, if you do like predictive service, if you do like when people act like they want you to be here, if you really want to have just exactly what you really need to do. And as I told, I'm not someone who wants to cut everything or do everything. I just want to be healthy. I want to go in the mountains and I want to swim properly, not like breathing like, I don't know.
Yeah.
I ran 20 kilometers and it's really the best place. And also delicious coffee.
Yeah, that's true.
And yeah, definitely it's for the best doctor ever. Okay, guys, now we have a quiz time. So I have like some celebrity names. And Dr. Kheda will tell us what she would like to do with them, like some kind of procedures.
Okay.
Or to do anything. So we will start with Leonardo DiCaprio.
Oh, detoxification with 10 passes ozone therapy, oxygen therapy, definitely. Sculpt for his belly. He definitely needs PVC room for the drainage, the face. What else? Some IV therapies, of course. Skin boosters, polylactic acid. Though there is a lot of work. I'm sorry.
We don't have so much time. Okay, then let's go to
Sorry, Leo.
Jeff Bezos.
Hair transplant? But I don't know where we will get the hair. So yeah, without the jokes, he looks good. But maybe just, for longevity, we can do the stem cells because he's just married. It will be good for his mental health. Also, it's not Ivy. He needed more energy because his new wife, she's very energy. Lauren, she's amazing. And what else? To look more younger and fresher, we can do the Endolift for his face, polylactic acid, and oxygen, of course.
Okay, next one. His wife, Lauren Sanchez.
A little magnesium.
Why?
She has a lot of energy, which is good. I don't know.
Maybe,
I like Lauren.
Maybe some recovery procedures. She's been to...
After marriage?
No, but she's been to... my gosh.
No, as I can see, she looks really, really good. Yeah, some of the people, they like, okay, her lips, but her lips is her natural anatomic, because I saw her pictures when she was young, and internet, of course. And so, there is her natural shape. We cannot do anything when it's exactly like
and
that.
she's been to space like a couple of months ago with the all women party. And they've been like with Katy Perry and...
you mean the recovery after? Yeah, for the recovery after, it's definitely ozone therapy and oxygen, definitely, because there is some radiation, not too much, but still, and this is stress. We can do IV with the immune boost, like vitamins, minerals, all these things. It will be very good for her.
So going to next, it's Elon Musk.
Ooh la la. The same like for the Leo. Completely the same.
Okay. Next one. That's a bit tricky to me because I think she's perfect. Dua Lipa.
She's perfect. I'm sorry. I love her too much. And I believe As I can see, her face is perfect, her skin is perfect. I think she's doing everything very well. I can give her the oxygen.
Period feeling will be just, and she's gorgeous again.
Yeah.
And the last one, President Donald Trump.
He's a perfect, because I have a trip in this summer to USA, so I cannot tell anything.
Thank you so much.
Let's make Este great again.
Давай. 3, 4.
Хоп, на-ни-на,
Нина.
хоп, на-ни-на, на-ни-на, хоп, на-ни-на, на-ни-на.
Este Show is done.